Nos encontramos en Sitges, en el Congreso de GESIDA, con Amy Justice, profesora de Yale, una de las grandes especialistas en SIDA a nivel mundial. The first question, the investigation for Yale today, the main question for the inquiry. The main question.
The main question for my study?
Sí.
My study is trying to understand how aging with HIV is alike and different from aging without HIV, and what we might do to improve the quality of life and survival of people aging with HIV. Because it is an observational study, we have the ability to look at many different questions in that regard and to study what treatments seem to help people and what treatments don't seem to help people who are aging with HIV. I have almost 150,000 people in my study. A third of those have HIV infection, 2/3 do not, but are age, race, gender, site matched, and behaviorally similar to those with HIV, so that we can really begin to understand how much of this is HIV and its treatment, and how much of it is other health behaviors and risk factors that people might have for these conditions.
With the project A Veteran Aged Cohort Study, ¿cómo es el resultado?
What will be the result?
What will be the result?
Yes.
So, by using observational data, very large databases, it's also called big data, we can begin to look at the effect of different choices for treatment. So statin therapy for lipid treatment, for example, in cardiovascular disease, or other treatments that are used outside of HIV. We can see whether or not those treatments have the same benefit or might have unexpected toxicities or interactions with the antiretroviral drugs. And since the antiretroviral drugs are by far and away the most effective, most helpful drugs people with HIV can be on, because they extend their lives, we want to make sure that none of these other drugs interfere with the benefits of the antiretroviral drugs, and which among them might actually help people who are living with HIV. Because there is a possibility that as people take more and more medication for both their HIV and all these other conditions, diabetes, heart disease, blood pressure, etc., that there may be some bad interactions between those many drugs called polypharmacy that could actually hurt people. So we want to be sure we understand which drugs help and which ones may not help in people on antiretroviral therapy.
Hoy es una utopía pensar que se puede terminar el SIDA.
Today is like a utopia of that we can finish almost ending the SIDA. It's a utopia. That we
is utopia?
Utopia of thinking, we're gonna get there to end up the SIDA.
Right. So my study is not focused on curing HIV. It's focused on living with HIV. Would you like me to comment on the cure?
En la cura. Yes. You want to comment on the cure?
So there are some very exciting examples of people apparently being cured with HIV. You know, the bone marrow transplant patients, for example, or the baby that was born
without,
and then appeared to not have not have the virus after being treated partially. Those are very exciting examples and give us hope. But it would not be practical to do bone marrow transplants on everyone, nor would it be a good idea because they are very toxic. So research is continuing to work in this area, but it will probably be some time before we have something available.
Con el paso de los años, algún tipo de enfermedad pueden afectar más a los enfermos de SIDA.
Through the pass of the years, there can be another disease that can affect us, the SIDA's AIDS patients. will pass another time? You
Yes.
think it will be another infections, another disease
Oh,
that
will
can
there
come?
be other things that will
Yeah,
come up?
up.
Yes, okay. So that's a great question. Right now, even in the cohorts that have a number of older people in them, the median ages are not, they're in the 50s, not the 60s or the 70s. And we know from people aging without HIV that what we see in the 60s and 70s tends to be different than what we see in the 50s. So it's a great question. People speculate that we're going to see more cardiovascular disease. We're going to see more strokes, more cognitive problems, more cancer. But we don't know with certainty until the group gets older. But that's the expectation, that we will see more of that.
Thank you.
Thank you very much. Thank you very much
Big success, Congresida.
for understanding.